Welcome to our last session on self-evaluation. In our previous 3 sessions, we have considered what is self-evaluation and supported you to think about how your service is doing and how you know this in relation to key question 5. How good is our care and support during the COVID-19 pandemic? This session is going to consider the question, what are we going to do now? The what are we going to do now question should help you prioritise and plan improvements that are based on the evidence you found. It is about challenging yourself to think about how good you can be and how you're going to get there. From the previous 2 questions, you should have a good idea of what's working well and what needs to improve. From that knowledge, you can develop plans for improvement, prioritise what's most important, who you need to involve, and think about any guidance, research, good practice examples, change ideas, and other support you might need. We recognise that change can be hard, especially if you believe things are working well. It's important not to become complacent and always strive to make things even better. Throughout our sessions, we have focused on an evaluative statement. We have summarised the actions we have taken. These are: we updated our All About Me forms to ask specific questions about how children had coped during lockdown. These were sent out and completed before children started back. Key workers reviewed the information and followed up with a phone call or video appointment. With parents or carers, we drew up plans to support children's individual needs. In some cases, we created enhanced settling in programmes and made changes to key workers and friendship groups. These changes were shared across the whole staff team. Using the range of resources available will help generate change or improvement ideas. We started by looking at the very good illustration in the COVID-19 self-evaluation guidance. We identified an area where the evaluative statement we had used as an example could be improved. We've done the same by identifying some of the health and social care standards which are relevant and could be used to help us generate improvement ideas. You can use good practice to support you. We've chosen some relevant examples from realising the ambition. We can use these to help generate improvement ideas. The reopening guidance also gives good information to support you to develop your change or improvement ideas. You can also get ideas from other sources, including brainstorming, social media, and your networks in the sector. Having looked at and considered a range of guidance, research and good practice examples, we've been able to identify a number of improvements we could make. We could consider rewriting our induction guidance to ensure we cover all the recently introduced changes to our setting. The introduction of virtual video tours, which would appeal to children and their families, home visits, enhanced settling in visits involving families visiting our service, flexible groupings to enable siblings to spend time together, or visual representations to support children with additional support needs. The circle of influence can help you in focusing your area for improvement. Is it within your scope or reach? Can you make the changes within your setting, or are the changes you would like to make out with your control? Make sure you spend your time and energy in areas where you do have influence and control. Using the circle of influence to look at some of our change ideas, we can discount some and we'll focus on others. For example, home visits would be of great benefit. However, currently these are unable to take place due to restrictions. This is something which has to be put on hold at present and is something we can't control or influence. We have also discounted flexible groupings for the time being. This will enable us to maintain group sizing in line with the current guidance. The circle of influence may still have left you with a number of improvement ideas for you to work on. Start with the one which will have the biggest impact on improving outcomes for children. As a team, decide which improvement is your priority. For example, we could rewrite the induction guidance, and this would be of some benefit, but it won't make the biggest difference to children or their families. In this case, we are going to record a virtual tour video clip to support children and their families as they return or as they begin to use the service. We feel this is going to have the biggest impact on improving outcomes for children at our service. However, every service is different and will have a different priority. The next step is to set a clear aim. There are 3 elements to consider when setting an improvement aim. What do you intend to do? Who is going to do it? And when are you going to do it? Setting an aim helps you keep on track. Here is an example of what our aim could be. You can clearly see how we have included each element, what, who, and by when. Record keeping is an essential element in improvement methodology. Ensure you record discussions, actions, and changes you have made to help you keep track of your progress. You will also be able to share the information with others to help demonstrate the quality and impact of your improvement. Remember, there's always improvements you can make. We've got more bite-sized sessions that will be available soon. These cover quick wins and an introduction into improvement methodology. We really value your feedback and use it to help us evaluate our work and make improvements. Please take some time to click on the link and complete the short survey about the 4 sessions on self-evaluation.